Welcome back. We're on with Colin Craig, president of secondstreet.org, as we unpack latest findings on dying on waitlists. An annual report you do. Yours is going to be released January 2025. Always fascinating, sad, very
Mhm.
depressing, but also fascinating. But let's take that depression and spin it. Let's find ways in which we can fix it. So you gave already one suggestion how things could become better. Give me some more areas or methods or points that the government could implement so that we could have, long term, perhaps even immediate relief.
Mhm. Yeah, so I think one of the best things we could do in the short term, especially Tanya, is to copy what the European Union does. And in the EU, they give all patients a right to go to another country in the European Union, pay for treatment, and then be reimbursed by their home government up to what their home government would spend to provide the procedure locally. So, as an example, if we copied this, and I'm just going to make up the numbers so that people can understand how the program works. Let's say you're in Alberta and you're waiting for a hip operation. And if the government were to provide you with that hip operation and it was going to cost, let's say, $20,000 for the government to provide it, but the government wasn't going to be able to get to you for another year or two, what this policy would mean would be that you could go to another country and pay for your surgery and then get reimbursed up to that $20,000 that the Alberta government would spend. So this way, the government is spending basically the same as what they would. In the EU, they will cover the lower amount too. So if you went somewhere where it costs less, well, then the government might actually save money.
Mm.
And we've actually just talked to a lot of patients from Alberta that have gone all the way to Lithuania for this for a hip operation. I think it was costing them somewhere around $13,000. So I mean, if they were to hand in their bills to the Alberta government would actually save money. But most importantly, what this does is this policy gives patients more choice. If they're facing a long wait time at home, they suddenly can go to providers around the world and get the care they need much faster, maybe
Yeah, and I
next
think
week.
that's amazing. I don't know why this can't be. Why? Well, let's talk about that. Why are some Canadians, not all, and I think when one has a health crisis, they kind of get to know how challenging the system can be. But why are some
Mhm.
Canadians so isolationist almost in their healthcare protectionism?
I think there's a loud vocal minority out there that just they don't want to see any change because they think it's going to mean that we're copying the US system. And to which we always point out there's nearly 200 countries on the planet, many other developed nations with universal healthcare that are providing better care to their patients. Those are the countries we should be looking at. And those are the countries that we do look at as an organization. So I just mentioned what they do in the European Union. I mean, throughout Europe, you'll find universal healthcare systems.
Mhm.
And I would guess most of them are performing better than ours if you really look at the numbers. I mean, that's what we've seen when we've seen analysis of different countries. So we should be looking at those countries, copying what they do. I just mentioned one policy. Another option would be to simply give patients choice. Use the public system or pay privately if you want to.
And
And
stay
we
within your
don't.
own province to do it.
Well, yeah, that's the hiccup is that right now you can travel to another province and pay throughout the country, with the exception of Quebec. Quebecers can pay locally, but in the rest of the country, you typically have to travel to another country, another province, and pay. You're not allowed to pay locally, and that ban just doesn't make any sense. No other developed nation on the planet does that. And if we took that restriction off, then patients would have more choice. We could help grow our healthcare sector because we'd end up seeing more providers, and more providers means more employees, and that would be a good thing.
And I find it challenging to understand how people, again, are so hesitant, like the administration that runs the healthcare system. I mean, many Canadians live south, very close to the US border. They're just going to take those dollars and spend them in America, who will
Hmm.
benefit from the jobs and the taxes, etc. That money could stay in this country. People just want the freedom to do that.
Yes, for sure. Yeah, and I mean, you raise very good questions. Like, why are people opposed? It's not really the general public anymore. Like I said, there's a vocal minority. Public opinion research that we've done when we've hired Leger to do it, it routinely shows the public is ready for reform in this country. We haven't seen the political class catch up
Mm.
and start to make the changes that are necessary. But hopefully we do because there's a lot of suffering going on in this country.
No, absolutely. And thank you so much for your time and for continuing to do this research because we would never know. And it's almost a warning to our viewers. Just be aware. this is happening, and maybe you need to make some phone calls to people who can make some decisions and get this going. Colin, thank you so much for your time. Always a pleasure.